Okay, hey everyone. This is Dr. Oz here. I'm here with soon-to-be Dr. Hassanein. She is currently a student at University of Texas, San Antonio, School of Dentistry. And she recently, congratulations, got accepted into the Oklahoma University Periodontics Residency program. So hats off to you. Congratulations on your accomplishment. So I wanted to interview soon-to-be Dr. Saba here, just about her experience through the application process, a little bit more emphasis on perio specifically. But we'll get into a few background questions about her first. So Dr. Saba, before we talk about perio, can you briefly walk us through your journey to dental school and through dental school?
So my journey is a little bit unconventional. I didn't go into the traditional route of going to the United States. Actually, I'm an international dentist from abroad. I graduated from England in 2022, and I worked for a year in practice, and then I did a GPR, hospital equivalent, and then I thought, you know what, let's go to the United States. And yeah, I've done the 2-year program and doing the equivalent of that. And I've learned a lot of things actually since being there. So it's I definitely enjoy my time. I'm gonna be hopefully starting my next chapter as well in a periodontics. So that will be really, really cool to find out in the future. Yeah.
Awesome. So, ignoring kind of the differentiation between dental school in England versus over here, just in general, just you as an aspiring dentist, what did you think dental school was going to be like before you started? And now that, you finished dental school abroad and you're about to finish your international program here, what's kind of your thoughts on where you were and what you thought dentistry was versus what you think it is now?
Honestly, I initially thought dental school was more procedure focused, learning different techniques, passing the exams, just finishing requirements. But I didn't really account that how much decision making goes into dentistry. The fact that you have to manage your own patients, and every patient, even if they have similar presentations, they're going to respond differently to treatment. So trying to get into understanding the biology behind patients, their behaviors, why they do certain things, that in itself was a big learning curve for me. And you're not just treating the disease, you're treating patients as humans. So that was a big thing that I found out when I was in dental school.
Yeah, actually interacting with live human beings and patients, right, is in practice very much different than what you imagine it to be when you're still in undergraduate studies or even the first couple of years of dental school.
Absolutely. Like just developing a rapport with them. And I always wanted to go into healthcare. So being able to interact with different people from all different walks of life, it's definitely very, it's so satisfying. It's rewarding as well in itself, and you can help them make a difference. So
Absolutely. So now that you've been in dental school and you've kind of gone through the progression and you kind of know what the industry is about, when did you start kind of thinking about specializing, and what kind of factors went into that, and how did you know you were going to pursue it?
So when I was in dental school, I knew I wanted to specialize. I just didn't know what exactly it would be. But really that kind of moment came to me when I was in foundation training. So I was working as a dentist, I was seeing different patients, doing I feel like as a general dentist, you're a jack of all trades, you're doing all sorts of things. But one particular case I remember is a patient that had come through my door, and she had such an aggressive form of periodontitis. She was only like in her 30s, and I was like, how? And she was quite emotional with me, and it's hard not to be emotional as well, because sometimes when it's hard to like not be able to take that from your patients and then have that affect on you. But I tried to do my best. I walked through her diagnosis. We did non-surgical therapy as well. And, after a couple of recall appointments, I saw that she was improving. And I was like, wow, peri does work. I didn't even think that. Like, I had a very skewed view of periodontics. I didn't think I learned it well enough or understood it really. When I was in the UK, I just thought it was just cleaning teeth. That's all it was. And then like a glorified hygienist. I know I shouldn't say that, but that's what I thought initially. And then I did a bit more research, and I was like, you know what? I didn't know there was even things like GPRs or regenerative treatments. I'm like, this is really the foundation of everything of old dentistry, and I want to make a difference. I want to be able to help these patients and not just refer and be out of my scope. So that was a big thing for me, and that eureka moment happened when I was in foundation training.
Awesome. And just for our listeners out there, foundation training, Dr. Hassanein, if you could give a brief explanation of what that is. Just a quick thing for our, non-international viewers.
So foundation training, so after you finish your 5 years in dental school, you have to do a compulsory training in general practice. And this is a government funded practice. So it's called the National Health Service. You work there for a year. And then once you work there, you can obtain your license to work, and, for life in the UK, basically.
Awesome. Thanks for the clarification.
No, you're welcome.
Yeah, it's awesome that you actually got to see one of these more complex cases, walk into your chair basically, and you got to be the decision maker and provider and see the outcomes of that patient interaction. So those are definitely very strong markers and kind of interest peakers, if you will, because I think there's a good portion of the dental students out there that kind of shared what you initially shared as your view, where you think perio is really just periodontal maintenance and making sure pockets are okay and there's no active gum disease going on. But there's an entire section of hard and soft tissue manipulation that and the entire field of implantology, really, right, that sometimes doesn't always get associated with perio right off the bat. Like for me personally, going to dental school, I didn't really know what periodontics was. Like I just learned that it was a specialty after I got into dental school. So it's nice to see that realization kind of comes along, but it's something where if you're not exposed to it, you may not realize it right off the bat.
And I feel like I spoke to so many, even general dentists or people who are quite into their careers, that if I could go back in time, I wish I had even considered perio. I wish I had done it instead, and that's why I want to say to any kind of applicants, don't wait, try, get that experience, of course, a couple of years in practice, hone your skills. But if you really want something and you feel like you have that drive, go ahead and for it. You never know, you could get in and then they can open so many doors for you.
So this kind of ties into my next question, where I was going to ask you if your experiences kind of shaped your decision to specialize, or did you actively shape your experience to match that desire to specialize? Did you have a specific aha moment? So, I mean, you had mentioned earlier that you had gone into dental school knowing you wanted to specialize, but you just weren't sure what in. So how did that affect how you actually planned your experiences in dental school? Did you seek out specific opportunities?
So for me, I actually wanted to do peds. I'm going to put it out there. I wanted to do peds when I was in dental school. I loved working with kids. I was doing like whole crowns, stainless steel crowns. I had the cutest peds patient too. So that was probably one of the reasons. But as soon as I want to start working in general practice, I was like, oh, this is a lot. I don't think I want to do children anymore. I don't want to see, I don't want to see them. But it's a lot more harder. There's a lot more behavior management. But there's a lot of transferable skills, I will say, with anything with peds. You got to be, shout out to my pediatric dentists. They're great. But I wanted something a little bit more surgical focused. And so I was starting to look at more options, and I really did enjoy oral surgery. That's actually why the main reason I actually went into a hospital career job, so I can do more surgical extractions, a lot of lacerations. I was suturing, doing on-calls. But I felt like the route to oral surgery itself it's super long as well. But I never really looked at oral surgery in a way that I wanted to do it. I just know for a fact that I wasn't really exposed to perio. And during that foundation training as well, we had a compulsory study day that we'd go in, and specialists from different countries would come over and speak to us about their specialty. And when the periodontist, came and spoke about his experiences in all these different cases, I was like, oh, that's a hopeless case. That tooth needs to go. They were like, no, we were able to save it within a couple of months through regenerative treatment. I was like, oh my gosh, I can't believe I never even had a second thought about this. So I decided to go on courses for one and see exactly what was perio was about, like a 20-hour one that I did with periodontists in the UK. And then I also shadowed some periodontists doing different surgeries. So PRF as well was a big one, that you can use the patient's blood and use that, put it in the bone graft. I was like, oh, this is super cool. Like I didn't think that perio was so diverse. So I think all those experiences alone, even though I had done everything to make sure I wanted to get into a certain specialty, for example, doing extracurricular activities, doing some research, doing a master's as well, part of part of my studies, it all kind of tied in together in the end, because end of the day, I got into the place I wanted to be, and all those skills I got were able to solidify my position to actually get into or make an application that was really strong enough to actually apply. And my interest in Perry just grew and grew even more.
That was really great insight. Especially, I really related a lot to what you said about getting different experiences out there. I think for the majority of students going into dental school, this is the first time you're experiencing truly like the entire world of dentistry and all the different specialties and the procedures and what's involved in each different facet of dentistry. Right, there's so much out there. So to really kind of get that broad experience and exposure, just to like, hey, let me try this out. You had talked about peds, right? Like it's something where I didn't really like, to be honest, but you get your different experiences with it, and you kind of start to be like, oh, this is what the day-to-day looks like. These are, actually the technical aspects of the job. Like this is, like you mentioned, behavior management was a big crucial component of pediatric dentistry. So just getting that broad exposure kind of gives you a taste of like, hey, maybe I'll like this, maybe I won't like this. And like yourself, like even upon dental school, like I wasn't really gung-ho on specializing. I thought I wanted to be like quote unquote super GP, right? So I did the whole GPR thing, and my GPR was great. I got a lot of great surgical experience there. That kind of led the foundation for my own path to perio. But it was really when I started working, I started doing like all the different things of dentistry and being like, oh, I really actually like this. Oh, I really actually don't like this, right? So for me, after kind of working for a couple of years, that's what gave me that clarity to, hey, you know what? I really like this specialty and I'm going to pursue it. Other people have that realization early on in dental school, and that's great, and they apply straight out of school. But I think sometimes, we as students kind of get locked in that mentality of like, oh, I need to go straight through, like that's not always the case, right? There are so many different paths out there. Everyone's life circumstances are a bit different. So how that ties into your career and where you are in life, it's not always a sprint. I'm sure everyone's heard it. This career is a marathon. There's a lot of different checkpoints along the way. So I think kind of restating what you said is just get your experience out there, kind of see what you like, what you don't like. Don't make a commitment to something where you're unsure of, because there's a big opportunity cost, right? It's time you're not working. There's tuitions involved. There's time away from family. It's a major life decision that's tied into your career. So
it really is, like 3, 4 years, 5 years. It's a big commitment, as you said, and they'll realize as well. So when you interview for positions, if you're passionate or not. So don't make that decision unless you're absolutely 100% all in, and then it will show through when your interviews as well.
Awesome. So I'm going to switch gears here to a little bit more technical questions regarding the application process in your experience through the application cycle. So just kind of an easy question right off the bat. When did you start let me ask you this. When did you decide like, hey, I'm going to apply for perio? And then when did you actually start gathering your application documents and materials?
I'm going to be honest. When I was trying to get into the United States, I applied for the international dental program. And then I was like, let me look into perio. What if I apply as well at the same time? And I didn't have the guts at the time to apply, but I did make a pass application. So that's the website you have to go on. And then you also have to pay like $100 to match as well. So if you are applying to different universities, you have to be attached to a match number or match code number. So then you can be accepted into a program. So I did that first. That was back in 2023, I want to say. And I thought, okay, let me just focus on the 2-year program. Once I got in, I was so shocked about how the different systems is in the United States. It's a lot more. You guys are great when it comes to your hand skills. You guys have the ADEX exam as well. We don't have that in the UK. So I did feel slightly overwhelmed with everything, but thankfully everything worked out well. And I thought, you know what? I'm here for a reason. Perry was still in the back of my mind. I'm like, no, I don't have no regrets. Let me apply. Let me make that move. So I applied last year in 2025. And in the perio cycle, you have different cycles. You have like, the match 1, match 2, phase, different phases. And perio was a lot more earlier. So I had applied just before August. So I had made my application. I think it was around May. So I was asking my, my referees to if it's okay with you guys, make me a recommendation letter. And they did. So let them know a couple of months in advance before you even send that button. I know they say there's not really much of a difference if you send it a little bit later, but honestly, if you do it earlier, you'll have a much more better chance of getting in, because they're going to be looking at your application earlier. So I had that in mind that by June, July time, I wanted to send the application. So I was telling them, April, May time to make me the recommendation letters, and that's what really helped me have a plan in motion. And then you have to pay the supplemental fees after you applied as well. So there's a lot of money, financial, kind of constraints for it. But end of the day, if you're organized and you know what you're going to do, it's all going to fall into place.
Yeah, you definitely touched upon a couple of things that I was actually going to ask you later on. So thanks
wow.
in advance. One of the things was, so just to recap, you started putting together your app in around May time. You had an internal deadline of submitting by like June, July. And that's actually something that I also recommend people to do. You want to get in earlier, just like you said, right? You don't want to get shifted towards the bottom of the pile just because of chronological order for whatever reason. You don't know if the admissions committees are going to just read the apps as they come in on a true rolling basis, or they say they're rolling, but really they designate 1 week where we're just going to sit down and go through these applications. So definitely just getting in early, giving yourself time, and also just to kind of double check that your documents got received, right? Sometimes you send in a transcript or something and the school didn't receive it, and that holds up your whole app from getting processed and marked as complete. So the more time you give yourself, definitely the better. I think what you said about asking letters of rec a couple months in advance, like around that May time, is great. I would say the same thing, April, May, right? My internal deadline was submit by July, so I wanted to give myself 3 to 4 months in advance actually, I should rephrase that. Give 3 to 4 months in advance to my recommenders, right? Because they also have their own stuff going on, right? They got personal lives,
give them a month, they'll forget.
Exactly. Yeah, they have so many things on their minds, and you're probably not the only person, asking them for a letter of rec more often than not. And if you really want that true personal one, it takes some time for them to sit down and like be in the state of mind to write it. So reminders is great, like you said. I recommend, people send it halfway to you let them know the deadline, give them a reminder halfway to the deadline, give them another reminder, a week or two before. Don't overdo it and be annoying, but
I know, but I rather be annoying.
Hey, you know what? It's quite literally your future that's on it,
right?
So a little reminder here and there won't hurt.
And things you can always change your referees. Let's say one particular faculty was taking a long more. That didn't happen to me, but I know some people did change their referees like midway through because some of them weren't responding or weren't doing them in a timely manner. So be really strategic who you ask. Just, someone that you worked with well, someone that is going to write good things about you as well. Have your CV and have your personal statement already written up, and you can send that over to them so they can actually write a really good, personal, recommendation letter about you. That would be my biggest advice as well.
Yep, and I will double down on those exact words. Okay, so what part of the application process or component of the application was the most challenging for you?
Ooh, honestly, I think it's just there's not everything in one place. There's so many different avenues. So, of course, we have the match application. So I didn't know that some universities are not part of the match, and then some are. So it makes you have to really do your research on every single university that you won't even want to consider. So some universities have different deadlines as well. So you got to make sure if you want to apply to that university, you got to be way in early in advance. So you might have to send off your application even earlier than expected because of those outside factors. So that was the biggest thing, I think. But I think if you have everything organized, you have a spreadsheet, make some notes so you know exactly what you're going to do. Even if you have some friends as well who are doing the same thing, asking them what they've done as well, or asking people who already are in residencies themselves, what did they do, what was their plan of action, so then you don't make the same mistakes, or make sure that you do something better. So you've got to make sure that your application stands out and it's the best of the best. And I would avoid mentioning anything negative in your application. Just don't say it. If there's something, you didn't do that, just don't say it. Don't mention it, because that is something that will pull you down. Just be all happy smiles, everything's rainbows and ponies. Like, don't mention anything negative. Just be yourself, and just really, and if they do like ask you about your challenges and weaknesses, then you can spin on that in the interview. But for now, application has to be golden. So that's my take on it.
I had a couple things. One caveat to that last portion you just said. I think
Mhm.
if there's something very glaring on your application,
Mm.
for example, maybe you have a low GPA, or you had something going on, and you had some personal life circumstances that were going on. Maybe personally you were going through a challenging time that was really affecting your performance in school, or something big picture that was affecting your performance as a dental student. I believe there is a section in there where you can just kind of have some additional comments. And the other way to play it is tackling the weakness head on, being like, hey, you know what, my GPA is low. Here's the reason. I have a legitimate reason. Don't just make up some random fluff. You'll
Right.
still see through that, right? But if there's something legitimate, then I think it's fair to give yourself an explanation, and then hopefully the rest of your application as a whole can perhaps compensate for that weakness, and might land you a few extra interviews. Um, and just for some context for people that aren't familiar, you had mentioned pass and match and all these sort of things, right? So the Idea Pass website is basically the centralized application service. It's very similar to AdSAS or Common App, right? So programs can choose to participate in the Idea Pass system, which again is just a centralized application service. That's where you input all your information, you submit your apps through there. Some schools do not participate in that, and you have to go directly to their website and apply directly to the school, right? So those are non-pass participating programs. Match is the actual ranking system where, again, not all schools participate in Match, but basically you have 4 interviews. You rank the schools 1 through 4 on how you would like to, match, and your chances of getting there. And then they do the same thing with all of the people they interview, and then the algorithm kind of literally matches you up. Some programs do not participate in Match. They send you an offer. Hey, we liked you. Here's your acceptance. And they give you some amount of time to accept it, like a week, 2 weeks, whatever it may be. And then you either choose to accept it, and then you have to forfeit the rest of your applications, or you choose to, turn it down, and then, continue playing the application cycle and seeing where it ends up. So just wanted to add that little context for people that
No,
aren't
it's
familiar.
true. It's a bit of a gambling game. So, do you go with only just a match program? Some schools also will only want you to apply to match schools, and they'll even make you sign like not a contract, an agreement to say that you're only going to be applying to match schools only. So, because there have been some instances in where people have applied to match, and once you're matched, that's it. That is your binding kind of place. You can't go away from it unless you have some extenuating circumstances that you can't take it. If you had accepted a place that is a non-match school, you have to let them know in advance. You have to let them know. So, and because if you don't, you could very well be blacklisted. So that's something to keep in mind. So for me, I made sure to only apply to match schools, so I didn't have to run into that problem. But everyone has their own opinions, and they can do what they want with their money, with their application, and where they want to go. Because at the end of the day, you're interviewing not just the place. They also want to interview you. So pick a place that you want to go to and you would love, and look at everything as a whole.
So I want to talk about a slightly different aspect to the application, and that's the personal statement. If that's a very important key piece of writing. That's the only time the committee is really going to hear from your own voice, unless you get an interview, right? Everything else is just stats and your resume, basically, and letters of rec, which is important, right? Those are other people's, your professional superiors, their words and how they view you, but obviously they want to hear from you as well. So what was kind of your process for drafting your personal statement? How many drafts or versions do you think you actually went through before you actually had your final submission ready document?
I don't think I even have a number. I think I went through so many, and that's very telling. But I think just write anything like in a Word document, and just write. It could be the most awful piece of writing ever, but I'll just have something down. I think the hardest part is starting that personal statement. You can also read other people's personal statements if they let you, but make it sure it's completely personal to you, of course. And another pair of eyes to read it over it, just to make sure that cross-checking. I know everyone's like obsessed with ChatGPT. I will just say it right now. You can use it, but use it smartly. Okay, don't go crazy with it. Just take a few things here and there, and just to see what you can improve on it. But I wouldn't use that as a basis because there is like AI detectors and whatnot. At least that's what I think. So make sure it is your own writing. They can tell if you haven't written it for yourself. I always wanted to make sure for the intro, okay, why perio? So that is like a statement. It has to be a small, it doesn't have to be super long. It could be like 3 or 4 lines worth of why you want to do it and why you want to go into a residency per se. And then after that, you can go into your experiences, like the bulk of it. Okay, what did you realize? What was your eureka moment that we just spoke about as well? Talk about these things, but even do a little story time. Go through examples as well, and back it up. It's kind of like the SMART technique. You say it, and then you back it up with evidence. So that's kind of technique. That's how I did it, and I felt like it worked for me. Everyone has a different style of writing, but if you can just, you only have like a page and a bit, so you got to be really succinct with your words and just be very, very forward. It doesn't have to be really flowery, but at the same time, you want to get across that passion and that motivation that you want to do perio or whatever residency that you want to get into.
Exactly. Keeping your words. And you said your personal statement ended up being like a page and a few lines or so.
Yeah, it wasn't as long. I actually think I could have made it shorter.
And was that single spaced or double spaced?
Oh, I think I did a single space actually. I don't think I want to make it cramped. That's what it was.
Yeah, that's what I advise people to do too, right? Like keep it a single space, at least for this context, right? I know some other type of professional schools may ask for something a little bit lengthier, but for us, there wasn't really any sort of guidelines. They didn't really give you a prompt, right? It's just kind of implied, okay, why are you applying to this program, right? Exactly. So hence why perio or why your chosen specialty, right? So like you said, keeping it succinct, being impactful, not using flowery language, but transmitting your story, right? They want to see, okay, you're putting in all this effort, you're applying to this particular specialty. Why, right? That's ultimately, that's what they want to know, why. So being really thoughtful and how should I say, just very intentional with your wording is definitely the right approach. And yeah, sometimes you just got to brainstorm. You just got to throw a bunch of ideas out there, crop through, like see what works, what doesn't work, what flows. Like it's definitely a process. It probably took me, it took me probably like, I would say 2 months, including all the tweaking and everything to like have my submission ready personal statement. What was it for you? How long do you think it took you start to finish?
Oh gosh, I think I started writing it. I want to say April time is when I started, and then I probably finished it just before the end of June. I want to say, so that's when I took some time, but I wanted to make sure it was perfect. And
exactly.
And I'm sure they've read so many personal statements. What is it that they're gonna see me and they're like, oh, this girl's unique. This person is why I wanna. They only select how many people for interviews, so you want to make sure that you're the creme de la creme. You want to make sure that you're there up top.
100%. A different aspect of your application. What do you think really stood out to you? Like it was there, like about your own application. Like, was there something that was consistently highlighted throughout your interviews where they're like, oh wow, like this is such a great experience you have? Like, did you have some experience like that?
Honestly, the main thing is because I was international, but not everyone is an international dentist. That was a big thing that they did mention a lot. Why would you not stay in the UK? Why would you go to the United States? And obviously I gave him my little spiel about that. But honestly, I think that what made me stand out was it's mostly if they can tell, they already want you. By the time if you have an interview, they already want you anyway. So just have that in that mindset that you're already in, and then your words will speak to yourself. I like to be very comfortable around people when I'm speaking about something. And I know end of the day, I just want to show them that I am the best person that they could even think about, so they should choose me. So I try to make conversation with them. It wasn't just an interview for me. It was just a normal back and forth conversation, even asking them questions as well, just to show that you're not just someone on paper. You're someone that is a real person with real dreams, and that you want to be able to be part of that with their school. So I think I want to say that I'm a relatable kind of person. I want to say I'm someone that is very big on equity, so any health equity. So I really wanted, my big dream is to kind of give back to the community. So I made that very, very clear in my personal statement. So in the future, I would love to give back to people back home as well. I'm from Sudan originally, so there's many people that are going through, war-torn conditions, and I want to be able to be that spokesperson or be that, be that leader to really help and make a difference in some way or another. And if that means if I can do it, other people as well who want to also who are from those from those countries or from different backgrounds can also say yes. If they can do it, they can definitely do it as well. So I think that was the biggest thing. At least that's what I want to believe anyway. That was the main thing why that would make me stand out.
Yeah, and that's kind of it's a subjective question I asked you, right? Because I could read your application in whole and be like, oh, you know what, something else really stood out to me, right? It really depends on the program and who's reading it. Like, obviously, that's a very unique experience that you had, and that's something I think the admissions committees that kind of look at at those unique experiences, right? Like something that got brought up for me a decent amount was the fact that I've had work experience here in the States, right? Versus someone that's coming straight out of dental school, right? The types of questions that I was asked, I wouldn't have imagined that they would be asking a fourth-year dental student or a rising student, right? So having those type of different experiences. Now, if you don't have those things, right, it is, again, just being very very intentional with your involvements and where you spend your efforts and how you actually spend your time, right? It's one thing just to be a member of a society or organization. It's another thing to have a leadership position in it and really go above and beyond just the school requirements to demonstrate your interest in that particular specialty, right? And I do agree with what you said about the receiving an interview portion. I think that if you receive an interview, these programs see you as someone that's potentially successful in their program, right? Otherwise, they wouldn't have extended you that interview to begin with. And like you said, they now kind of want to see the person behind the numbers, the person behind the story, how you hold the conversation, how you think on your feet, how you present yourself, right? All those kind of things to fit, but to kind of tell them hey, does this person truly, will they mesh with our other co-residents? Will they mesh with the faculty? Will they be contributors to our program? Or are they just kind of going to be here, check in, check out, and not really care, to be honest?
That was a big thing. I remember in the interview, those were the kind of things I wanted to ask them about. So you're not just, they're interviewing you, but you're interviewing them. So I want to know about this residence, how many residents do they have? How is it like? What's the structure of the program? So those kind of things. And then they will know that you've actually done some outside reading as well about the program. That you're not just I'm here for an interview, that's all, and just talk about me. No, you've also done your due diligence and read about it. And that's what they want. They want someone well-read. God knows you're going to be reading so much literature when you're in a residency program. You better believe you got to be researching around the program too.
So I have a few more technical questions about the application. Mm-hmm. One was it was a follow-up to the strengths thing. What do you think was something that maybe wasn't a strong point in your own application? And what do you think helped to offset that?
What wouldn't be a strong thing in the application? Honestly, I think I never did an externship. That was a big thing. I thought, oh my gosh, there are people who I was speaking to, they're like, they've done an externship. I'm like, oh shoot. I was really concentrating on my 2-year program that I didn't even think about going to a different college or a different university or whatever you guys call it here. But yeah, to do an externship. And I thought that would be a big thing. But I thought, no, we're not gonna, let this not be the factor that doesn't let me get an interview. So I was like, let me shadow my school. At least let me do the next best thing and shadow my school at least. So I made sure to any kind of free period that I had, I made sure I used to shadow at the period department and help out, even assist, just to kind of make it, and it kind of made it seem as if it was kind of like an externship. I kind of, not to say that I kind of made it look like that in my application, but I did say that I shadowed, I learned so much. And, arguably San Antonio is actually one of it's a really, really good peri program. So I think I was quite fortunate to be there as well. And then I was able to speak to one of the best professors as well to get their kind of insight at what the program offered as well. So I knew what I wanted from a program as well. So that was a big thing. And I think, a big thing for me is I was seeing periodontists as well, the residents themselves. They were giving out presentations and case presentations. For one, I'm not someone that is completely great when it comes to public speaking. That's something I'm still trying to trying to get better at. It still is a work in progress, but I feel like getting myself outside of the comfort zone and being able to speak to people as well has definitely improved. Even dentistry, you're speaking to so many different people. So that in itself has helped, and I really wanted to push myself to the limits and apply to some, even if I'm not the most well-versed person in the world. I can definitely try and show my enthusiasm through that, and hopefully they can see that, and I can see that in me, and they can take a chance into me, and it worked, I guess, because I got placed. So that's great.
There you go. Exactly. It's like having that confidence in yourself and what you've done. And I really liked what you said about kind of creating your own externship, because it's hard, right? You have all these, clinical requirements in school, or, in my case, I was working, different time constraints that may prohibit you from going on these externships. But not going and just applying, you may not look as favorably as to someone that did do those externships. So by actually spending time in your home university in that specialties department, even though it wasn't an official externship and you were just spending time, it was real hours you were putting in and real exposure and experience that you got and could talk about and be like, hey, I spent, however many hours in official assist and blah, blah, blah up in the PG department. And I got a firsthand look at the specialty and I know I want to do it, right? Um, Externships from school to school are pretty much, you do the same thing, right? You sit in their lit
Exactly.
presentations or case discussion, you shadow in clinic a little bit, kind of chop it up with the faculty and the other residents a little bit. It's like what you do is the same. There is definitely value in doing an externship. I did a couple, and you get to see firsthand what the program is like. And although it's a small taste, they range from, a day to a whole week, depending on the program.
Yeah.
You definitely get a firsthand look if you're seriously considering that school, right? Because everything else you're just kind of scouring online, I guess, or trying to talk to different residents for information. So to be there physically in person and see, oh, this is what it's like here, especially, again, you're committing 3 years or however long your specialty is, and potentially hundreds of thousands of dollars, up to that point. So it's a big decision to make. So you want to be sure about it. So kind of going off of that, what were some of the factors that you were looking at when deciding where to apply?
So I wanted to, at first I thought, okay, apply to a program which has the most residents. At least that's initially what I thought would be the best chance. But as soon as I read more about it, I realized that wasn't a great fit for me. I wanted something with a limited number of residents, maybe 3 to 4, like 2 to 4 residents at the very most. Because at the end of the day, you want to get that experience. If you're spreading yourself so thinly with 12 other residents, not to say that's a bad thing if you want to apply to those universities, then you can. But that was a big thing. That was a big factor for me. I wanted to make sure that I had a personalized mentorship with these people, that they would know me personally, and I was able to get along with my residents as well. So that was one big thing that I was definitely looking for in a program. Also, cost is a big thing as well. I wanted a program that would not take me, not break the bank. I wanted something a little bit more cheaper. I just came out of dental school. You're already a $500,000 out, like $1 in debt, and you want to make sure that when you go into a residency that you're not going to be even more in debt. So that was, money was a big factor. Also, location was more of a secondary thing. I didn't really mind where I was. End of the day, I just wanted a place that I know I would enjoy, maybe a little bit of city life, not too bad. But end of the day, you can't really choose. But if you're going to apply to a place, you better make sure that it's a place that you'd see yourself in, because you never know, in March you could be placed there, and then there's no way out at that point. So those are three big things there. But then also the research is a big factor as well. You're going to do research if it's within your program or not. And I was fortunate enough to do a little bit of like that of research when I was in England. So I already knew what I was getting myself into. But I enjoyed going through different studies, doing the statistics around why we do certain things and what would be better, what treatment model would be better than another treatment model. So I think if a program had all of those things in place, and yes, that would be my program, and that I would have.
1,000%. And especially in the upcoming years with the new student loan rules that are in place, getting money is going to become very difficult, and paying it back, the terms and the landscape has changed quite significantly. So unfortunately, we are always kind of hearing, pursue what you're passionate about, do what you want, but at the same time, there is a very real economic cost to consider. And you kind of have to run that cost benefit analysis for yourself, and see kind of what goes on and what makes sense for you. I will add on another factor that you didn't mention. The things that you mentioned are all things that I looked at too, and I think are extremely important things that everyone should look at when considering specialty. But I would also add in the strength of the program director specifically. That's kind of adding on to the faculty. Like you had said, right? In these residency programs, you're going to be learning from a handful of faculty. These are going to be your mentors that shape you as a specialist, right? Like your quality upon like your own clinical skills and research and academia and everything upon graduation is going to be rooted in those faculty essentially.
100%.
So it starts with the leader, which is the program director, right? You definitely want a program director that's very involved. Something that I looked at, in addition to the strength of the program director, right? Like, were the residents speaking highly of them, and are they a great teacher and whatnot? I also specifically asked programs about the mix of their faculty. I was looking for a faculty base where they had a mix of private practice experience, academic experience, research. Like, I wanted to get a little bit of everything in there, because I think that just gives you a more well-rounded experience, right? You get different exposures even within the specialty, to see the different career path and just different perspectives and viewpoints. So that's something that was really valuable in when I was evaluating schools.
Honestly, where were you when I was looking at programs? That's actually they're really good points. Really good points.
Yeah. Hey, this is why this is why application ambassadors exist, right? We're trying to make this information public knowledge, because that's actually a question I had, right? Because it's so hard to research these programs, right? Like, I found that the primary way to research is to actually try and get a hold of a resident and speak to them about their direct experiences there. Like, I had a whole question template, like a list ready to go, like of different things that I wanted to know about their program, right? Because these websites just kind of give you some basic demographic information and some like, here are some deadlines and here's some facts, and like, you don't really get a sense of like, okay, tell me about the program itself, like, what's the experience going to be like? And I think that's information that you can only gather by talking to residents. But I wanted to ask you, what was kind of your discovery process like?
So yeah, I tried, if I had an interview, for example, if I landed one, I would first ask the residents in my program, so do you know anyone that's gone to this university, or anyone who's done this university or interviewed at that point? And I was lucky enough to find people who did. You'd be surprised how well connected everyone is in the perio world. So you'll be finding when you go into residency that you're going to be networking so much. So even before then, though, I was asking questions to the residents, saying, okay, what's your experience like? Even people who didn't interview with those programs, what was your whole protocol with asking questions? What did you want to find out, and stuff? But I think the main thing, I think you touched on such great points as well about asking about that mixed bag as well. If you want to go into private practice, or if you want to stay in academia, then there are avenues even after you graduate and you become that specialist, of course, that you don't just have to go into private practice. You can do other things as well, or you can do a mix of both. So just to see different exposures as well, and put yourself up there and be flexible, because you never know which route you're going to go into.
And then once you actually got your interviews and completed your interviews, what was kind of your decision-making process in terms of creating your rank list?
Ooh, okay. So honestly, it was more like, I don't say I want to go off vibes, but I was going off vibes. I was like, oh my God, I really like that place. Or if I didn't really like a program, I wouldn't rank them, because you could very well get your very last choice and be ranked there. So anywhere that I thought, no, I don't see myself there, even though if I had the opportunity to get an interview, amazing. But if their values didn't align with mine, there's no point putting myself into a 3-year commitment where I'm going to be miserable. So main thing was location. Obviously, I wanted to be, very close if I could be. And if, with family, I have some family as well who are in New York. I have some family in Florida as well, and other places. But I wanted to be closer to the extended range. That's just a more personal point for me anyway. But you can't always choose that. Another one is, money. As I did say, money is a big thing. If they give me a stipend, if they have, how many loans do I have to take out? How much is it per year? And another big thing was the if they actually reached out to me. I saw some universities reached out to me and be like, oh, it was really nice seeing you. It wasn't just a whole, it was a nice little touch. Like some gave me a thank you card. I thought, oh my gosh, that's so unheard of. Like, give me a thank you card at the end. But you kind of see as well that some programs, when you do even more research, even after the interview, and you're like, oh my gosh, I didn't even know about this, or you find out more stuff during the interview as well. And then you kind of, I would recommend putting that in some kind of, as soon as you finish with the interview, write notes about that, because you're gonna forget it. You're gonna forget it all. So write notes about what you liked and what you didn't like. And once you have that done, then you can rank and you can compare all of them together. That's what I did. As soon as I finished the interview, this is what, I didn't like that they, this particular faculty member I didn't really vibe with. I wasn't quite sure if I could be, not to say that could be that, but that could be a big thing. Someone could really rub you off the wrong way, unfortunately, and then that could be something that could put them down to the lowest rank of the list. But I do think ranking as many programs as possible is a good thing to do as well. But if there's a 100% chance that you do not like a program, don't rank it. That's my main thing.
Yeah, that's a lot of great information. There's so many different factors that you look at. And like you said, there's so many different things that you're evaluating. Like you said earlier, it's a two-way street, right? They're evaluating you, you're evaluating them. Mm-hmm. And I did something very similar to you, actually. After I interviewed, I like wrote down some things that stood out to me, like just kind of my recap about that interview process and the program. And then when I was creating my own rank list, I actually created, 5 different categories, like, my different factors that I valued, like the program director strength of the faculty, costs, all that stuff, we had talked about. And I basically created a point system, like I went off the vibes, right? Like emotionally what I wanted. And then also like, okay, here are the like logistical facts, and I'm kind of meeting somewhere in the middle, and hopefully, your number one choices or top choices line up on both lists. But I think that's something that's very important to do for sure.
Yeah, and also asking about their how many extractions they've done, how many maxillary sinuses lifts they've done, how many implants. So then you can know program how much you're doing, what kind of experience that you're going to be getting in the future as well. That's something to add to interview as well. So, and then you can use that as your rank tally sheet as well, and be like, oh, this program does this program does that. So that's one thing.
I think what you just talked about, asking about the number of procedures. I did ask those to residents I was speaking to, but some common feedback I heard was, most of the, I don't know what your experience was talking to residents. Mine was like, everyone was super chill, really upfront. Like, I mean, they're kind of like us. They're in similar positions. Obviously they're further along in the career arc, but like just in terms of like, they're our generation of people for the most part, right? So they just speak to us like as friends almost, which is really nice because you get to hear some valuable insight. But something they did comment about was, it can be a little bit taboo to ask, the specific numbers of each procedures. So I think that really just kind of depends on the resident you're talking to, and if you get a good vibe from them and just kind of feel like, oh yeah, like they seem pretty chill and they'll, tell me about this information. But, they did make it a point to say that's something where perhaps don't ask during the interview itself. That's information perhaps you should try and obtain outside of the formal interview process.
Yes, I agree with the residents, because you are going to be speaking to them as well.
So I have one last logistical question and then just a few reflection questions, and we'll wrap it up. Mm-hmm. So the last logistical question for you regarding your application is, if you had to improve upon one aspect, something you could have done better to make your application process go a little bit smoother, what would that have change look like?
I probably maybe would have like seeked mentorship a lot more earlier. If I had known that Perio is what I wanted to go into initially from the get-go, I probably would have maybe changed a few things. I don't think it would have changed everything drastically, but I started learning a lot from people. For example, Dr. Mealy, he's a really good professor at the San Antonio, or got involved in more research or journal clubs. I think I would have had a much more of a clear idea what I would have done as well to make my application stronger. So yeah, I kind of wish I had tapped in a bit sooner, but everything happens for a reason, I think, and it's at least we had that initial spark of interest, and I think it's what you make It's what you make out of it, really. So asking more questions, even if you don't ask, you don't get. So trying to put yourself out there as much as you can, and anything that you can do to make your application stand out, I think that's great. But even if it's not peri related as well, doing extracurricular activities, like I, for one, used to play the cello, or I play badminton, or go to the gym. Make those known to the faculty as well. Don't just be very, into, oh my gosh, perio in dentistry, because they want to see that you're not just any any John Doe around the street or something. You're someone that has a little bit about themselves, and that you could actually work with their work ethic and with the residents, the dynamic of those residents as well. And they also mark you as well. The residents will be doing all their own little confidence level tally sheet or whatever when they meet you. So socialize, don't be quiet. Speak to as many people as you can. And you're doing yourself a favor as well by doing those things. So yeah, I would put yourself out there a bit more. That would be my advice.
That's perfect. That answered that question and a few more questions I have later on.
Oh,
So perfect. Um, what's some piece of advice that you would give to someone that's perhaps a little bit on the fence about specializing, or thinks that they may not be like very competitive in this current cycle?
ooh, well, if they, there's no harm in not trying. At least if when you do try, you can put your application out there. Maybe don't go crazy with the number of schools you apply for. But I don't think there's any harm in trying. However, if you feel like your application isn't competitive and you don't know exactly what you want to do, then by all means, take a year out, or work in general practice, hone your skills. You might find something that you do like, and that's what I had my Eureka moment, was when I'm working in general practice. So you'll be surprised, because sometimes dental school doesn't provide you with a very holistic view of everything, all the specialties, and you might have to do your own due diligence outside to see what you like. So even when you're in private practice, you might have your own periodontist, you might have your own endodontist or something. You can speak to these people and see what their journey was like, and then you can put two and two together and be like, if this is for me, or do I just want to be a super GP, or do I want to do something a little bit different? Do I enjoy a certain procedure? And once you know, then you can, even if you didn't know at first and you're like, oh my God, I'm behind, I haven't done this much stuff, you already have outside experience. So don't put yourself down for, if you feel like you're going to be a late bloomer. There's no such thing as that. When it comes to specialty training, everyone is in their own journey of learning. And even as a general dentist, you keep on learning as well, with doing CE courses as well. So it's if you feel like it's the time and everything and the stars align and everything is right for you, do it. Take the chance, and don't question it. Just go ahead for it. And if you feel like you will need that more outside experience, then you can do that by all means. And you can try talking to more people, so you know how the application process is like, and chew it into the application ambassadors, and then you'll know what to do. And then go from there, and you'll be pleasantly surprised. You'll be surprised where you can get into, which place you'll go into. And even if you don't get in, okay, that's just a redirection. It's not failure. It's just a challenge, and you can be upfront about them. Be like, hey, wasn't my first cycle. This is my second. It'll show that you are very serious about trying to get into a specialty. So that's not a bad thing. I actually look at that as a good thing if someone has applied again.
That's all very valuable insight. Yeah, a lot of great things to digest there if you're someone that kind of find yourselves in the shoes. And yeah, like you said, it's not an end all be all thing, right? You could apply 1 year, perhaps you don't get interviews or at all, or maybe you get, one thing I would advise people to do very early on in their school selection process is assume that you get the interview and that you match there. We had talked about this earlier, like, is that a place you want to be, right? Despite the cost, despite the location, despite everything. Kind of the barometer of question that I used was like, okay, I got an interview from this school. Am I going to rank them or not? And if I rank them and I get in there, would I be okay with that or not okay with that, right? And at the end of the day, it's like, sure, that may not have been your top choice, but you will become a periodontist, at the end of the day. And as long as it's a good program and you could see like, yes, this program has value to me and I will derive value from it, I think that's something that you should go ahead and rank. But if you're like, you know what, even if I get in there, the cost is going to drown me and I'm going to be so stressed, or I truly did not like the vibe there, and you're just like, I would be miserable there, then perhaps it's worth, rolling the dice and applying and getting next cycle if you don't get in as many options as you initially thought you might.
It's a toss up.
Thank you for that. Last question for you. And I want to correct something for our listeners. I had mentioned you're going to Oklahoma, University of Oklahoma for perio. That's a mistake. You are actually attending the Ohio State University.
The Ohio State. We get a bit touchy about that. Just
saying. my sincerest apologies to all the Buckeyes out there, even though I have a lot of Michigan ties. But
they're not going to be happy about that.
Yeah. What's something about Ohio State that really stuck out to you? Like, what are some of the strengths that you like, or something that really just like you're like excited to go there?
Honestly, I really love the campus. I know that's really silly, but it kind of reminded me a little bit of England. I want to go a little bit home. I felt like in Texas, everything's so flat, but that's just me just looking at it, the scenery. But no, I really like the faculty. The residents as well are super sweet people, and I can't wait to actually spend the next 3 years with these people. I felt like I found my people. They made it, even having the little dinner at the end as well, the interviews, making people feel right at home. So this little small thing, even I remember it was like 7 stations I had. The last station, I could not give a damn. Me and the interviewers were just laughing for no reason. It was just like, oh my gosh, we're both tired. It was, and I thought, that's it. I'm not getting in, but it was a very surreal experience. Obviously, that wasn't the whole interview, right? I actually was answered pretty well for the other ones. But I think how they kind of conduct, how the clinics look as well. The clinics look amazing. That's for one. And I really enjoyed my time when I was there in Ohio. I'd never been. It was in Columbus. And it's the Ohio State. What's not to like? I can rep it with everyone else. I can have my little red tag, get my sweater and everything else. So I can't wait to be part of that group. And I'll be doing what I love. So it's one of the oldest perio programs in the country. So in I want to say 1930s, but I think it's 1940s that it was first established. So yeah, why not go there? We've got the oldest programs ever. So I'll be there.
Awesome. Yeah, we're definitely very excited to see all the great things you're going to accomplish over there. It'll be fun to follow along the journey. Is there anything you want to leave our listeners with? Any like inside tidbit, fun fact, anything at all? Those stages yours.
Oh, me? Oh my gosh, don't put me on the spot. But no, I think any applicants that are out there, take the plunge. Our application is more than you think, okay? You've got everything there. You just got to be organized and put everything in one spot. Ask people, know what you're going to do. And even if you don't know what you're going to do, you're going to find that answer sooner or later. Perio is a great, great profession. I applaud everyone to look into the specialty. I was a kind of a naive mindset when I was, back then when I thought perio was just cleaning teeth. Don't have that mindset. It's really, really good. And I think if you're someone that wants to place implants, wants to do, sinus lifts, I feel like the whole philosophy of perio is saving as many teeth as possible. And that resonated with me mostly. I want to be able to be that middleman, be that person that can work with different clinicians and different specialties, and they come to me, and I can help them with that. So I think definitely look into it. It's a great way to form new connections and also just doing something that you love. Dentistry is a great obviously career, but you can really advance yourself even more with this. So, but yeah, that's my 2 cents there. But good luck to everyone applying, and I'm sure you're going to have some great news hopefully next year, the year after that, and keep on going and don't give up.
Awesome. Great words of encouragement, great advice. This entire interview was jam-packed with great value. So I definitely really appreciate your time and efforts in speaking with me and sharing your journey. It's been quite a pleasure. So I'm excited to see you at a future AAP meeting and seeing what cool stuff you got lined up.
I can't wait. See you soon.
All righty. Thank you so much, soon to be American doctor, Sabah Hassanein.
Thank
already
you.
got
You did it right.
the British
You
degrees.
did. You did. Absolutely great. Well done. That was great pronunciation too.